This video will learn about tubercular meningitis. It's an inflammation of leptomeninges. So it's the most common cause of meningitis in India. So why? Because many people here are still unvaccinated. So this main role of BCG vaccine is prevention of TB complications like abdominal TB, disseminated TB, TB of bone, TB of meningitis will be prevented from this BCG vaccine. So if they are unvaccinated, they are more prone for the primary infection as well as development of complications of TB, right? So this unvaccinated young children, immunocompromised patients and the previous history of TB patients, all these are affected by TB meningitis. So what happens here, coming to the pathogenesis, first there will be primary infection in the lung. So from the lymphatics and the blood, it will spread to the brain, right? So lymphatic and the hematogenous spread to the brain. So there will be formation of caseous lesions. This is called as metastatic caseous lesions in the cerebral cortex, meninges and the choroid plexus. So we have the specific term called as rich focus, which we call this caseous lesions in the brain. It's called as rich foci. So from the rich foci, there will be exudates releasing. So this exudates released from this rich focus will be entering this meningeal blood vessels and blocks it, right? So it will cause infection, infraction, obstruction. So this obstruction to the CSF will be causing hydrocephalus, right? So obstruction in the brain cisternae causes this hydrocephalus. So what happens once this hydrocephalus occurs? There will be rising in the intracranial pressure. There will be bulging of this anterior frontanelle. And once the intracranial pressure rises, there will be vasospasm, vasoconstriction leading to the cerebral ischemia, right? So in the basal meninges, you can see this exudates and also tubercles can be seen. Ventricles are dilated due to the hydrocephalus. Cerebral ischemia infraction can be seen. Basal inflammation can be seen because of all the tuberculars and exudates, infection and all. Fibrosis can be seen. Caseous lesions can be seen. Cranial nerve compression can be seen, right? So what will be the symptoms? First, there will be fever associated with vomiting, weight loss, loss of appetite, stagnation of developmental milestones. So just write this generalized TB symptoms. And then write about this TB meningitis symptoms like headache associated with vomiting, rise in the CSF pressure because there is hydrocephalus plus obstruction to the CSF flow, there will be rising in the CSF pressure. And also cranial nerve 3, 6, 7 palsy. And also disturbance in the speech and the movement, semi-consciousness, convulsions can be seen. So bulging of anterior frontanelle is seen because of hydrocephalus, raised intracranial pressure. So it has a specific sign. It's called as crackpot sign, right? So bulging of anterior frontanelle is called as crackpot sign. It is seen in TB meningitis. Next, they can develop hemiplegia, opistomus and dilated pupils, hypertension because of raised intracranial pressure again, loss of vision because of cranial nerve palsies, optic atrophy, pyramidal signs, tentorial herniation due to the hydrocephalus. So all this can be seen. Other complications like growth hormone, gonadotropins release affected. So there will be delayed developmental milestones, delay in the growth hormone, delay in the gonadotropin. So all will lead to the delayed growth and delayed sexual development and also diabetic insipidus, right? So coming to the diagnosis, you can do this chest x-ray. You can see this miliary mottling in the lung. So primary focus can be seen, which is called as Ghon's focus, I guess. And also in the CT scan, you can see thickening of meningitis because this x-rays will be going and depositing in the meninges. It will cause inflammation, infection there. So it will lead to thickening of meninges. And hydrocephalus because the blockage of CSF, and cerebral infraction because of rising in the intracranial pressure leading to vasoconstriction and the cerebral ischemia. And then edema, tuberculoma can also be seen, right? So also you can see this rich focus in the brain, caseous lesions, metastatic caseous lesions in the brain, right? And also antibody detection by ELISA, antigen detection by lattice agglutination and the ELISA, molecular methods like PCR can be done. So for the CSF, so it's important to write from the lumbar puncture you obtain this CSF. So it will be clear, colorless and forms this cobweb appearance. So how will be the CSF? It will be clear, colorless, forms cobweb appearance indicating this fibrinogen. So what is basically cobweb appearance? It is because on standing there will be coagulation of fibrinogen, right? So it will be leading to cobweb appearance. And the CSF pressure will be raised above 300. Total protein will also be raised. And also glucose is reduced, chlorides are reduced, but the cells, so the main cells which are seen in the TB meningitis is lymphocytes, which are 500 to 700 in number. Polymorphs are also seen like which are less than like 5 cells. And Zn staining is done because of acid-fast bacilli. Tuberculosis is an acid-fast bacilli. You can do Zn staining. And Gram stain, Indian ink stain are negative. Zn stain is positive, right? So lymphocytes are predominant. So this lymphocytes produce something called as ADA, which is adenosine deaminase. So also whenever there are high number of lymphocytes, so there will be high adenosine deaminase also, right? So hemorrhagic lesions with fibrinoid necrosis can be seen, and also leukocyte count can be seen, which is from 100 to 500 cells. So coming to the CSF centrifugation and culture, it is done in LJ media for 1 to 2 months. And treatment, you can give them anti-tubercular therapy and steroids is given to prevent adhesions. So first 6 weeks you have to give them steroids, which will prevent this adhesion formation, right? Which will prevent this adhesion formation and prevents this hydrocephalus also. So it decreases the complications like hydrocephalus, cerebral infraction, cerebral ischemia and all. So based on the neuroimaging, once you feel like the person is recovering well, you can stop using the steroids. So anti-tuberculosis therapy, steroids, and then surgical intervention. If there is any tuberculoma, you can just surgically go and remove it. Or if there is any hydrocephalus, you can just put shunts. And if there is any abscess, you just drain it. So if we revise this whole thing. So what is tubercular meningitis? It's an inflammation of what? Leptomeninges by this bacteria, right? So just write it is seen in unvaccinated children, immunocompromised and previous history of TB people and all. So what is the pathogenesis? First, there is infection in the lung through the lymph and the blood. It spreads to the brain. So they will produce this metastatic caseous lesions, which is called as rich foci in the brain, right? So this exudates will form this infection, infraction, obstruction in the blood vessels, leading to hydrocephalus, increase in the intracranial pressure and also cerebral ischemia. So all this you can see in the imaging. So this basal meninges will be having exudate, tubercles can be found, ventricles are dilated, and cerebral infraction, basal inflammation, all this can be seen, right? So coming to the symptoms, first write this generalized TB symptoms like fever, vomiting, weight loss, loss of appetite, stagnation of developmental milestones and all. Coming to second, just write this brain symptoms like headache associated with vomiting. There will be hydrocephalus, so rise in the intracranial pressure and CSF pressure, and also compression leading to this nerve palsy, which is third, sixth, seventh nerve palsies. Other symptoms like semi-consciousness, convulsions, speech and movement disturbances. So bulging of anterior frontal is called as crackpot sign. So whenever you see this hydrocephalus in the TB, just remember bulging of anterior frontal will cause crackpot sign, right? And third, just write the progression of this CNS symptoms only. Hemiplegia, opisthostomos, dilated pupil, hypertension, loss of vision because of cranial nerves involvement, optic atrophy. Just write this eye symptoms also. Tentorial herniation, don't forget this tentorial herniation because of hydrocephalus. And fourth, you just write end stage, like they'll be having developmental delay in the sexual development, growth development, all this. So diagnosis, first you do chest x-ray, then you do CT scan. In the chest x-ray you can see this miliary molting, and in the CT scan you can see rich focus, thickening of meninges, hydrocephalus, tuberculoma, edema, infraction, inflammation, all this. Just write whatever the things we learned in the pathogenesis here. And then antibody detection ELISA, antigen detection by latest agglutination, molecular methods by PCR. So coming to the CSF, it will be colorless, clear, cobweb appearance can be seen because of coagulation of fibrinogen, right? Coagulation, cobweb appearance. And pressure will be raised, protein will be raised, glucose and chlorides will be reduced, cells will be raised, which are predominantly lymphocyte cells. So this lymphocyte cells will be producing something called as ADA, which is adenosine deaminase. So this will also be rising in the tubercular meningitis. So because it's an acid fast bacilli, you can do this ZN staining, which is positive. So coming to treatment, just 4 things: anti-tubercular therapy, steroids to decrease these adhesions and also decrease the complications, and then surgical intervention if there is any tuberculoma or hydrocephalus. If there is any abscess, you just drain it. This is about it. Bye.